According to the World Health Organization, approximately 25% of the world's population has an infection related to an intestinal parasite. In tropical and subtropical areas with limited access to clean water and sanitation, that number is as high as 50%. The most common intestinal parasite infection globally is ascariasis. It affects about 1 billion people worldwide. Intestinal parasites include worms and single-celled organisms that live in your intestines. A parasite is an organism that lives off another organism. Parasites use the host's body for nourishment and shelter. They rely on the host as a vehicle to spread to the next potential host, where they can continue multiplying and spreading. In return, intestinal parasites provide zero benefits. Instead, they can cause unpleasant symptoms and in some cases, pose serious health risk. Today on your Health TV talk show, The Physicians will be discussing intestinal parasites, the risk factors, causes, types, complications, and of course, preventive measures. Stay tuned. It's another day with the physicians where your health is our business, and as we always say, will always remain our business. My name is Dr. Martina Agbere, a regular anchor on this program. And of course, I don't do it alone. I'm always with my very intelligent, celebratory shrink, no other person than our able, always smiling, Dr.
Memuna Yusuf Kadru. Welcome to your favorite Health TV talk show, The Physicians, where your health is our business.
And of course, will always
be our business.
So we're talking about intestinal parasites.
Yeah.
And
as the word is, a parasite.
Yes, a parasite, you know how it is, one that who leeches is always there. You're not getting anything from the person. There's always feeding on you. Memuna, I want to just say something. Well, growing up in your community, or even you, did you ever have these intestinal worms at any time?
Yes, now, and then they will give us, then it's a particular medication.
Green color.
Let's not go there. Just sending me those memory down the lane. Like, and technology has really evolved, life has evolved, everything has evolved. Then, when they give you that medication, sometimes you may not even know exactly what they give you. The next thing, you are now pulling out the worms. It's like nightmare. I was traumatized, like talking about it, I'm re-traumatized.
At times, the one that is most scary, we see the little child
running with it down. No.
Then the mother will say, wait, let me pull it out. But then people will be saying, don't pull, because if it cuts, it's going to cause a problem.
It will grow back, it will affect you again. But now it's so different that when you take the medication, now the dewormer, whatever it is, you don't know, you're pulling it out, you don't even feel it. But for me, I think the most important thing that we are bringing on board with this intestinal parasite is the fact that oftentimes when we talk about it, adults just believe that it's only children that should take care of their...
never dewormed.
You will see adults, when you dare ask them, sir, ma, have you dewormed in recent tests? What do you mean? It's not for children. Like... That's why you are having some challenges. That's why your body is not, a lot of times you are feeling some general, awareness, and just by deworming, just to clear your gut, may just be the solution.
Anyway, as usual, we'll have an expert that will tell us more about intestinal parasites, if they are actually even beneficial.
Exactly.
To us. We'll definitely, she will deep dive more into that. So we're back after this short break. Don't go away. We'll be discussing intestinal parasite types, the symptoms, presentation. Okay? We're back after this short break. Stay tuned.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Diarvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Diarvite from LB Pharma. Diarvite, love yourself.
Welcome to your favorite health TV talk show, The Physicians, where your health is our business. We'll be discussing intestinal parasites. And in the studio with me is no other person than our very, very cerebral consultant public health physician. He's also an associate prof with the College of Medicine, University of Lagos, a public health advocate, Dr. ALERO Roberts. Welcome to our program.
Thank you so much for having me.
Welcome.
Thank you for having me again and again.
Yeah, always smiling.
Thank you.
With the stuff just there. Okay, so we'll be talking about intestinal parasites. Maybe first tell us, what are intestinal parasites?
Exactly what you said. Parasites in the intestine of, you know me, I would like to break it down to what they live in the digestive tract. And they are of no benefit whatsoever to them. Because I heard you discussing before the show started. Zero benefit to the human being.
As the name is, parasite.
Parasite.
Just to feed on.
There's no commensal about it. There's no symbiotic relation. You know all those big things we learned in biology in those days. And they are a global health concern. It's not just an individual or a local concern. They're a global health concern, particularly in areas where there's very poor sanitation and equally poor health resources, weakened health resources.
What are the different types of them? Definitely we must have different types. So
there are different types. I think, let me break it down like this. There are the single cell organisms that we can't really see with the human eye, things like Giardia lamblia, you know, things like Entamoeba histolytica. And those ones, of course, the smaller they are, the more problem they cause.
Definitely.
You know, and there's even one, cryptosporidiosis, I don't know if you remember that, that is now causing problems among people who are living with the HIV virus. Then there are the helminths, the worms. And of course, like you quite rightly said before the program started, ascariasis, Ascaris lumbricoides, ascaris, the roundworm, that is the commonest globally. And you know, that traumatizing experience that Dr. Medina spoke about, I mean, we've seen them in very dramatic instances. You know, I just have to digress a little bit. There was a case that came in of a young child with intestinal obstruction. And of course, you know how that thing is. It comes in accident and emergency. Everybody's on high alert. Everybody's running up and down. Get blood, get this.
Everything.
Rush to theater. And the gastrosurgeon opened up. You can't believe. Worms. That's ascaris. You know, so it is a problem and one we really need to. Of course, there are other ones, the hookworm that also leads to anemia. That's hookworm anemia, and we are seeing that a bit more now in the urban areas, but traditionally more of an agrarian, rural, you know, everywhere where there are farmlands. And of course, the tapeworms, you know, that can be very problematic, particularly the pork tapeworm that can cause cysticoides in the brain.
So I like the fact we are breaking it down so that people can begin to hear and understand that it's not just one thing. There's several, and then whether you are living in the most bourgeois area, whatever, some of these things are, and from our introduction is 25%, you know, of the world. So it's not like it's one area or it has to be this person. So how do they infect humans, and what are the primary causes of this infection?
The major form of infection of intestinal parasites is eating. Poor sanitation, unwashed hands, unwashed fruit and vegetables, and then you ingest it. And that's why, you know, it seems to be commoner in children than in adults, because of course children are the ones who are going to be playing all around in the sand, in the ground, playing ball, whatnot, rushing, mommy, and grab a piece of orange in the kitchen or whatever, and it's straight into their mouth. And both their hands are unwashed. The orange is not what tangerine or agbalumo or almond or whatever it is, or they pluck the almond. You know, they are playing and there's the almond tree and they have thrown stick, thrown stone. Ingestion is the commonest cause. And then poor water hygiene. you know, they are drinking water.
Water is not even available.
Or what? Yes,
exactly.
You know, so if you're drinking water from an unsafe source, contaminated water and whatnot, those are the two commonest ones. Other things that can happen: you're walking barefoot. That's hookworm, and it enters through the bare feet. You're swimming in contaminated waters. A lot of our local waters are contaminated with human excrement, which means that the eggs from an infected person are freely swimming around in the water. You can't tell children not to swim, and so on and so forth. It doesn't even help with the rainy seasons that has caused, you know, contamination of groundwater. You have contamination with the sewage.
Yeah.
You know, because a lot of us in the urban areas use what's that thing called?
The water system?
Yeah, the water system going into your own personal sewage. Cesspool. Septic tank. Septic tank is the word I'm looking for. Then, of course, the rains come, flooding.
Exactly, and then all flows out.
Flows out and flows back into the groundwater, causing what previously could have been, because a lot of us are using boreholes.
Yeah.
Well, we are not using boreholes. We're using what are known as shallow wells.
Shallow wells,
public health.
yes.
A borehole goes right down.
The waterbed.
But the shallow wells is the one we all dig 10 to 15 feet down. It's not a borehole, it's a shallow well. So it's very easily contaminated with... Then, of course, if you are now living in a very bourgeoisie area of town, Christmas is coming, you are going back home for Christmas. It may be an area that's endemic with parasites, and you walk into that, you've got a very high chance of becoming infected. And then if you have a weak immune system, which in this economy is not difficult.
Yeah, because people are not eating
well. We are stressed. We are managing levels of that.
Managing resources.
Managing resources.
With low immunity.
Eating without protein, very low protein.
Quality.
Yeah,
So
more
you've got all
carbohydrates.
that. And then, of course, with children, you pack children together in daycare centers, nursery schools, and a lot more of that is happening because every mother has to go to work. Is now working outside.
So we have congested daycare.
Congested daycare and very poor sanitation.
Not even washing hands from the anal region to the
I think we've covered literally everybody's lifestyle.
So now talking about, you've talked about the lifestyle, the mode of transmission. So how do these people, how do they present? People that actually have intestinal parasites affected them. How do they present? Because initially you talked about even anemia.
Yes.
Yeah.
So it really depends on who has got it and what you've got. Now with things like, most commonly, 100% of cases, the patient will have abdominal pain, cramping, diarrhea, bloating, even nausea and vomiting. You know, you will find one or other of them because something has to bring the person to the hospital. With children, we tend to see what we call failure to thrive. The child is just not
growing
as well as he or she ought to grow. So that's another. And then fatigue and weakness, because these are the symptoms of anemia. The person is constantly fatigued. You spoke of a patient, an adult patient, and you said, have you considered deworming? Only that's for children. No, but it's not. You know, you find yourself unusually fatigued and weak. It's time to get and I like calling it a head-to-toe checkup. Just go and get a head-to-toe checkup. And if the physician tells you you need to take some deworming medication, nothing spoil. Just take it. I promise you will not have that nightmarish traumatic experience of Dr. Meguna spoke about. Other symptoms, malnutrition is one of them. So all the features of malnutrition, sores at the side of the mouth, poor skin, friable hair, mouth odor, whatnot, is all there.
So unfortunately, you're going to have a lot of
we are seeing so much of that. We are seeing so much of that, and we're really having to go back to the basics in the sense that, again, we are talking about what? My favorite topic, water and sanitation, hygiene.
Yeah, right.
Because water in and, whatnot is all what is causing this sort of thing. Of course, in cases like you described, that traumatic experience, you actually see the worms in the stool. Or segmented portions of the worms in the stool. But I mean,
so let's quickly talk about the the possible, the complications. We'll talk about the complications. And we already talked about the presentation. So the complications and management, how do you manage it?
Well, the complications are, obviously in cases where there's unrestrained growth of the parasites, you've got loads and loads of what we call a heavy worm burden, a really heavy worm load, and that can cause complications. Another very scary complication that I remember reading about was a child that could have a very high fever from some other cause. Malaria being the top, viral infection. And because the body temperature has gone up so high, the worms decide, oh, it's too hot in here. And they start coming out, particularly ascariasis worms. So that can be a very frightening, again, another traumatic experience for children. And, so the other complications, of course, symptoms of intestinal obstruction and then actual intestinal obstruction. Of course, you have malabsorption. The body is just not absorbing the correct nutrients. The worms are eating it all. So you have all the features of malnutrition, weight loss, fatigue, weakness, anemia, which can lead to a whole new load of complications. And of course, all these complications are worse in children because children can manifest these complications literally, as my pediatric teacher would say, from morning to night. Starts off in the morning, perfectly all right, and by nighttime has become an accident and emergency case. So this is, it's something we need to take really very seriously. Adults may have the reserve, the physical reserve to be able to carry worms for a lot longer. I don't know why anybody would want to, but children do not have that reserve. Malnutrition in a child is very, very bad because it means that their brain isn't developing as it ought to, is not able to absorb what it needs to learn, whether in school, whether at home. So these are some of the complications. How do we manage? Oh, sorry.
So I was going to say, before we go into management, it's good for our viewers to also get to know how often should they deworm in children and in adults, and then in the management, what is the role of diet and nutrition in the recovery process? Okay,
so first of all, how often to deworm? We usually, it depends basically where you live. So if you're in a high-risk area, we would say every 3 months. If you're in a low-risk area, maybe once a year, or maybe you don't need to at all. Because the deworming argument is a yes and no. It really depends on where you live and the level of sanitation and hygiene that you provide. But I know that government has run several campaigns of deworming school children. Good idea, fantastic campaign, because school children particularly need to be able to learn everything they can in school, and it's a good place to. But deworming without the other measures.
Exactly. It's
work done. Yes, it's like pouring water into a basket. Because if you now deworm, but you're not teaching the children proper sanitation and hygiene practices, it's just a vicious circle. So when we are coming to management, one of the things is, first of all, how do we make a diagnosis? How do we know whether you have worms or not? It's usually a history and an examination, and most physicians are very well versed in the ability to do this. And so my advice is, if you are a little suspicious and you're really not sure, trot along to your nearest primary healthcare center. The officer in charge there is well able to make an informed diagnosis and then decide whether you need to go on and do other investigations. The most common investigation we do, of course, is a stool examination. And that one can easily be done even in the primary healthcare clinic, and decide to see whether you see either the cysts or the eggs or the larvae of the worms. There are other sophisticated investigations, but I don't think at our level they're needed. Once we have a high suspicion, a high index of suspicion, we go on to the next thing, which of course is giving the appropriate medication. Now, the appropriate medication depends again on the worm and the locality. Because don't forget, a child will not, or nobody has worms in isolation. You got it from somewhere. You understand? So we know, for instance, in our locality, this is the commonest kind of worm. These are the medications that are effective, and they are part of the essential drug list. So all the primary healthcare clinics carry them. So it's not even something that you I need to tell you, oh, go and buy this, go and buy that. I wouldn't even do that, because again, the giving of medication is really dependent on the clinical condition of the person. So it's something that shouldn't be done just willy-nilly like that, unless it's a previously healthy person, part of a school campaign. We don't tend to, I will not sit down here and say, go and buy this, go and buy that.
And I think it's best for us not to even have that, because like, we always say on this show, medications are highly individualized.
Very
It's
highly.
not a one-size-fits-all.
Exactly.
So, listening and watching us and say, oh, what
What
is
did
the
she say?
medication?
What did you say?
No.
We're not
You
gonna
feel
do
all
that.
those symptoms that, Dr. ALERO has elaborated, and we have been talking in the studio. It's the best time for you to go to see your primary care physician or primary care center, and then
Take it from there.
Take it from there, yeah.
Yeah.
So prevention.
Wash your hands. Water and sanitation hygiene. WASH. Wash.
So W,
Water
A,
and
S,
sanitation
H.
hygiene.
That is it.
No, sincerely, you'll be very shocked. I mean, I did a quiet poll amongst my friends, and you can imagine that my own friends are not, they are not small people. And I said, when you immediately enter your house, what's the first thing you do?
So wash the hands.
Wash. Actually, the first thing I do is put my bag on the floor.
And then do washing.
Second thing is wash my hands. Yeah. Even if I don't even bother to say, where did I go? Maybe I went to back, I didn't.
No, just go
straight there.
You have to make it a habit.
Your hands. It just has to become
a
habit. As I keep saying, if you know you will not wake up and leave your house without brushing your teeth, do not enter your house without washing your hands.
That's a very good way of relating.
Yes, that's how
we should develop that habit.
And of course, the 5 important points of hand washing: before and after visiting the toilet, before and after changing a baby's nappy, before and after eating, before and after preparing food. All those 5 points, to me, they are 15, but that's
very important.
And as much as possible, if you can use soap and running water, that is ideal. And we can create all kinds of things to make running water. There are all sorts of little devices I've seen where you fill and the water just runs, and you can wash so that the water washes.
Clothes.
And then also wash things before you eat. It's incredible the number of people I've seen. They buy oranges on the road
and just eat like that
and cut it open and
because
eat
you believe they're selling already water.
Yes.
What's the water they use? Most of them.
I wish it was the water they use. Who is peeling the orange? Is it not a young boy, peeling the orange? When he wants to urinate, what has he done? He's gone to urinate and come back. And he's peeling the orange again.
If you even look at it from that aspect, you wouldn't want to even take those things.
Well, but this is the thing. But these are things that if we don't think about, we don't take.
It's only when there's an outbreak people remember to do that, which is wrong.
Because these intestinal parasites are an outbreak. It's not even it's an endemic problem, and like we said, globally. So it's something we have to think
about. Why won't part of the school health? Why don't they even do it in schools? They just
we do.
Immunize.
We do. We do. I can speak for Lagos State.
Lagos State.
I can speak for Lagos State. It is done.
Okay.
Yeah, that one is part of the school health campaign, which is not even a campaign. It's part of the school health program. Yes.
Thank you, Dr. ALERO. You've spoken so well about this topic, and I'm sure we won't have to wait until another outbreak before we begin to wash our hands.
I hope not.
Trust me, we'll bring you right back. We talked about intestinal parasites. You come and school us again about how to maintain proper gut health. Thank you so much, Dr. ALERO. We really appreciate it. And so for joining us today, I do want to appreciate you all for keeping a date with the physicians. You've heard it all from Dr. ALERO. Intestinal parasites. Parasites do not, they're parasites, they're just a name. You don't benefit from them. They benefit from you and put you in trouble. You can avoid that by being health conscious, okay? Wash your hands before and after anything that you want to do. It's very important. When you go out, come back home, wash your hands. When you buy something, before you eat that thing, try as much as possible to also wash it. And also teach the children to do the needful. My name remains Dr. Martina Agberie. Till next time, stay blessed.
Thank you so much, Dr. ALERO. This was very enlightening, and of course, though at the beginning, worms, again, but thank you so much to all our viewers out there. One statement I want to take away is the fact that if you cannot leave your house without brushing your mouth, when you get back into your house, you should also wash your hands. So it's something that is a habit you have to develop. So why will you come home without washing your hands? Because you have gone out, now you are coming back. So keep that hygiene proper so that you avoid these parasites that can cause you trouble. Parasites have everything to benefit from you, but you have everything to lose, because that's why they are called parasites. Please be kind to follow us on all our various social media platforms. And if you want to be a guest just like Dr. ALERO here, go to our website, fill the form, and you'll be right here, also schooling millions of people all over the world. If you've ever missed any of our programs, our YouTube page is there to serve you right. Go watch over 250 videos that give you the right information that you need. My name is Dr. Memona Yusuf Kadri. Until next time, remain blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite nutritional supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.